Anatomy and Physiology of Basic Respiratory Mechanics by Kimberly Jared. What is pulmonary respiration? It is respiration through lungs, breathing movement, exchanging gases in the lungs, transporting gases by blood, and exchanging gases by tissue. This process of exchanging gases adjusts the pH of the blood in your body. The breathing movement in your body includes inhalation and exhalation, or also known as inspiration and expiration. There are many structures involved with the anatomy and physiology of respiratory mechanics. The structures are the nose, pharynx, larynx, trachea, bronchi, lungs, bronchioles, alveolar ducts, and alveoli. Some additional and important structures involved with pulmonary respiration are the diaphragm and several accessory muscles, including the pectoralis major and minor, scalene muscles, the serratus, anterior and posterior superior, the sternocleidomastoid, and the levator muscles. Inspiration is the intake of air into the lungs. It is an active process. The diaphragm is the primary muscle used. As contraction and a downward motion of the diaphragm causes a negative pressure in the chest, it draws in the air. The accessory muscles help to raise the sternum and increase thoracic space, which helps the diaphragm. Expiration is the expulsion of air from the lungs. When you exhale, you relax and muscles are not required. However, with forced expiration and also with chronic pulmonary diseases, accessory and abdominal muscles are used. The conduction zone is the passageway for air to move in and out of the lungs. It helps to warm, moisten, and to filter the air. The structures involved in the conduction zone are the nose, pharynx, larynx, trachea, bronchi, and bronchioles. The respiratory zone is deep in the lungs, and it involves the respiratory bronchioles, alveolar ducts, and the alveoli. The respiratory zone is where the gas exchange occurs. It allows inhaled oxygen to diffuse into the lung capillaries in exchange for the carbon dioxide. The majority of gas exchange takes place within the alveoli. There is pulmonary surfactant produced by the cells lining the alveoli. It reduces surface tension and it allows the alveoli to keep open for gas exchange. In a minute, I'm going to read you a helpful story and show you a picture to help you remember the following terms that are listed on this slide. But first, I'm going to tell you what each of these terms are and what they mean in regards to lung volume and capacities. Tidal volume is the amount of air that moves in and out of the airways with each inspiration and expiration during normal breathing. It is usually about 500 milliliters. Inspiratory reserve volume is the amount of air you can inspire beyond your normal tidal volume. Expiratory reserve volume is the amount of air you can expire beyond your normal tide volume. Residual volume is the amount of air that is left over and it remains in the respiratory system after a forced expiration. Vital capacity is the maximum amount of air a person can expel from the lungs after a maximum inspiration. And minute ventilation is the total volume of air taken into the body during 1 minute. Take a good look at this picture. I'm going to read a story from the book, Clinical Physiology Made Ridiculously Simple, Edition 2 by Dr. Stephen Goldberg. It breaks down the terms used on the previous slide in regards to lung volumes and capacities. Here is the story. Imagine a TV set, in a house. The width of the house in the figure represents the difference in the volume of the lung between maximum inspiration and maximum expiration. On either side of the TV tidal volume are Irving, IRV, and Irving, ERV. They get tired of the TV, so they go outside to use their RV. The weather is cold and icy, and they get into an accident, leading them to crash into their own house, whereupon they mutter, "This frickin' ice," FRC, IC. They are admitted to the hospital where they have their vital signs, VC, taken. They recover because they are given tender loving care, TLC. Note that the terms higher up in the house are inclusive of the terms below them. The specific significance of each term was just explained. Once again, here are the terms that were used and abbreviated on this slide I'm going to show you. There's the picture of them, and there's all the terms that were used for the story in here and there. What is the rate of respiration? In adults, it's 12 to 20 breaths per minute. In children, it's 15 to 30 breaths per minute. And babies, it's about 25 to 60 breaths per minute. This all depends on the age of the children. For infants, newborns, it varies with if they're a few months old, 6 months old, children, various ages, and then adults as well. And it just depends person to person. How is breathing controlled? Well, the medulla oblongata, it helps control normal and resting inspiration, and the pons helps to regulate the amount of air taken in with each breath. Internal respiration is the transport of oxygen in the blood from the lungs to the cells. It transports metabolic carbon dioxide from tissue into the blood and lungs. External respiration. In external respiration, most of the carbon dioxide is carried to the lungs in plasma as bicarbonate ions, HCO3. When blood enters the pulmonary capillaries, the bicarbonate ions and hydrogen ions are converted to carbonic acid, H2CO3, and then back into carbon dioxide and water. I'm going to end with a quote that I like a lot. It just reminds us of being alive. Place your hand over your heart. Feel that? That's called purpose. You're alive for a reason. Don't forget it. Thank you for watching.